In this video, we will discover every pertinent medical fact about meningitis. Meningitis is an infection of the meninges, which are the protective membranes that surround the brain and spinal cord. Your brain and spinal cord are protected from damage by the meninges, which also house nerves, blood vessels, and a fluid called cerebrospinal fluid. The cerebrospinal fluid performs vital functions, including providing nourishment, waste removal, and protection to the brain. Although meningitis can affect people of any age, it most frequently affects infants, young children, teenagers, and young adults. If meningitis is not treated quickly, it can become very serious. It may result in sepsis, a potentially fatal blood poisoning, and may harm the brain or nerves permanently. There are several vaccines that provide some protection against meningitis. What is the difference between meningitis and encephalitis? The location of the inflammation is what differentiates encephalitis from meningitis. In contrast to encephalitis, which affects the brain itself, meningitis affects the protective lining of the brain and spinal cord. What about causes of meningitis? Infection with bacteria or viruses is the usual cause of meningitis. The most prevalent and least dangerous type of meningitis is viral, while bacterial meningitis is rare, but can be quite dangerous if left untreated. Fungal meningitis, parasite meningitis, and drug-induced aseptic meningitis are among additional causes of meningitis. Meningitis risk factors include immune system weakness, spleen damage, head trauma, alcohol use disorder, and serious infections like pneumonia or blood infection. What signs and symptoms indicate meningitis? The symptoms are classified into two groups: general symptoms and neurological symptoms. General symptoms include fever, anorexia, vomiting, body aches, and rapid breathing. Neurological symptoms include irritability, confusion, severe headache, stiff neck, and fits or seizures. What about meningitis complications? Serious complications are possible, particularly if meningitis is left untreated. Memory issues, hearing loss, vision loss, epilepsy, brain damage, movement abnormalities, and infrequently shock and death could all be complications. How does meningitis spread? Whether the reason is infectious or not will determine how you get meningitis. Although some of its causes are communicable, meningitis itself is not contagious. Meningitis can be transmitted from person to person in the majority of bacterial and viral cases. Meningitis can be transmitted from an infectious disease spread from person to person by a virus or bacteria. Food contaminated with an infectious agent can cause meningitis. Meningitis can be acquired from swimming in or consuming water that has been contaminated with an infectious substance. Fungi in the environment that you breathe in can cause meningitis. Meningitis can develop as a side effect from cancer and other severe disorders, which are not infectious. Meningitis can develop because of brain surgery or a head injury. Meningitis can occur as a side effect of drugs like corticosteroids. How is meningitis diagnosed? Clinical examination of the patient is the first stage in the diagnosis of meningitis. The Brudzinski's sign and the Kernig's sign are two distinct signs of a meningitis infection. In Brudzinski's signs, your doctor will pull your neck forward slowly. Neck stiffness and involuntary bending of the knees and hips can indicate meningitis. In Kernig's sign, your doctor will flex your leg at the knee and bend the leg forward at the hip. Then, they will slowly straighten your leg. Intense pain in your back or thigh can indicate meningitis. Recent studies, however, indicate that many meningitis patients do not exhibit these signs. Even if one of these tests comes out negative, meningitis is still a possibility. Microscopical analysis of a cerebrospinal fluid sample obtained from the patient via lumbar puncture or spinal tap serves as the diagnostic technique for diagnosis. To check for brain inflammation, we can also use a CT scan or an MRI to acquire images of the brain. How is meningitis treated? Meningitis treatment is based on the underlying cause. Antibiotics are used to treat bacterial meningitis. Antifungal medications are used to treat fungus meningitis. Antiviral medications are used to treat viral meningitis. Some forms of meningitis are not specifically treated. Drugs may be used to treat the symptoms or lessen the inflammation. Following the commencement of your meningitis therapy, you might begin to feel better within a few days to a week. It may take weeks to months to fully heal. How can I lower my chance of contracting meningitis? By taking a few easy precautions to guard against the infectious infections that most frequently cause it, you can significantly lower your risk of developing meningitis. There are numerous vaccines that aid in preventing viral and bacterial infections that might cause meningitis. The meningococcal disease, pneumococcal disease, Haemophilus influenza, and tuberculosis vaccines are among the bacterial diseases for which they are available. Vaccination against viruses include those for measles, mumps, chickenpox, and influenza. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.